We're doing several things in addition to just preparing for social isolation. We are doing patient care at a distance. We are doing several things. We have drive-through clinics to do the patient testing that are being set up in 4 different sites across the Covenant system. And I know at UMC there are sites as well that Dr. Reagan is going to speak to. We have drive-through clinics that are being set up at Grace Clinic, at Health Plus, at the Northwest Clinic, and at Southwest Medical Park. We are encouraging our patients to self-isolate. A lot of patients and some physicians in the region think that a patient that gets a positive diagnosis or a presumptive positive diagnosis needs to be in the hospital. Nothing could be further from the truth. COVID-19 is just like any other viral illness. If you have mild to moderate symptoms, you should self-isolate at home. You should support yourself, and we're putting in place some video conferencing capabilities so that we can actually support and follow and check on the welfare of those patients who are self-isolating at home. Those are not in place yet, but we're working rapidly on trying to get that in full capability on both sides of the street. Again, all of the doctors that we have talked to and have worked with agree that social distancing is the right thing to do. We need our public to understand this is not a fallacy. This really works if we will do it. We need our folks to wash their hands. Washing your hands with soap and water, and it doesn't have to be an alcohol-based hand cleaner, which are all completely out of stock at all of the supermarkets. Soap and water is actually as effective as any of the alcohol-based hand cleaners. Unless a patient is in severe respiratory distress or has severe exercise intolerance, they don't need to be in the hospital. In fact, being in the hospital is the worst thing we can do on the South Plains. We need people to take care of themselves at home, just like we would ask them to do if they had the flu. You do need to call your doctor. There are criteria by which you will need to be tested. There are also a lot of worried well people. The worried well are the ones that think they might have it, but they really don't have any symptoms. The capability of doing testing across the entire United States is somewhat limited. We need to use our resources carefully. We need to make sure that we're using the testing capability that we have for the appropriate patients. For that reason, the health department has put in place a screening criteria, and a patient has to meet those screening criteria before they're even a candidate to be tested. So we support those efforts, we agree with those efforts, and we need to reassure the public that if they fail to meet the screening criteria, they probably don't need to be tested. Right now, the only real capability we have for testing is with the health department, and we have other commercial labs that are coming online that will offer the opportunity to do testing, albeit at a cost. But it takes a time, usually 3 to 4 days, to get those results back. Whereas the health department has done a great job of getting those results back to us within usually anywhere from 12 to 36 hours. So by getting those results faster, we actually minimize the necessity of utilizing valuable personal protective equipment over the long period of time. So educate yourself, be aware. Use reliable sources. Use the CDC sources. Use the World Health Organization sources. The health department has some valuable resources. Getting our information on this contamination from Facebook and Instagram is not the place to do it. We need to be requesting information and getting information from valuable sources like the ones I mentioned. As I said, Covenant and UMC are working together. We are in lockstep to address this crisis. We're trying to identify how much equipment we all have. We're talking about ways that we can move patients back and forth to make sure that we have the resources available. And both hospital systems are collaborating with smaller health systems in the region to make sure that we bring the right patients to Lubbock and keep the wrong patients essentially in their community where they need to be self-isolating at home. We've had questions about our caregivers. Are our caregivers refusing to take care of COVID-19 patients? I will tell you with enthusiasm, our caregivers have stepped up, both at UMC and at Covenant. They have not bucked one bit about their professional responsibility to care for the sick. We are going to care for these folks to the best of our ability. We are doing some things like setting visitor policies in place that limit the number of visitors. And that's one of the areas that Michael and I have worked very hard to synchronize so that both hospitals are doing the same things at the same time. We have limited the number of visitors, outside visitors, to our patients to one visitor per patient. The reason for that is, if you think about it, the people that are already admitted to the hospital are there because they have a disease process. They are already vulnerable. The last thing they need is for us to put COVID-19 on top of whatever disease they're admitted to the hospital for at this point in time. It's not to keep people in the public from coming to the hospital and catching the virus. It's to keep our hospitalized patients from acquiring viruses from people that travel in from the outside. It's really important that you understand that. To this point, we have had 3 confirmed COVID-19 cases in Lubbock County. We've had several patients under investigation, the majority of which have ruled out. So we are working together. It's important for this community to understand that our healthcare facilities have come together in this time of crisis to make sure that we are as prepared as we can possibly be. You need to understand what our capabilities are. You need to understand that when we ask you to do certain things like social distancing, quarantining yourself at home, we're doing that in your best interest. So I'm going to turn the microphone over to Dr. Reagan and let him add to what I've already said about UMC's contribution to this. Mike?
Yes, sir. So Dr. Ryan, thank you very much for those comments, and I would just say that we agree with your sentiment, both the directions around public health and also the message that we are working closely together to coordinate our efforts. We have a mantra at UMC, firm but not fearful. Through this crisis, that's what we're saying. So we're taking firm resolve to take good, prudent action. We're committed to our responsibilities for caring for patients across the region. We're also committed to do it in the right way, and I think that's true for Covenant as well. We are called to be a calming influence. If you spend any time on Facebook, you'll hear lots of fright out there. We're very proud of our hospital and medical staff. As Dr. Ryan said, they're stepping up to take great care of individuals in our community, both those with COVID and other patients. We do have concerns about their safety and about their peace of mind. This is a challenging time for everyone, and so we're putting that as a top priority for us. For the community, Dr. Ryan outlined practices. Good hand hygiene is a big piece of that. If you're sick, isolate yourself, avoid large crowds, all those things you're hearing lots about, and we fully endorse that idea. We do need to diminish the spread of this illness. It's very important. Most of us will probably end up getting this virus, but also most of us will come through the virus just fine. And so we want to spread that out, and that is good public health practice that will do that for us. Dr. Ryan stated that we have 3 positive cases, and those are related to travel. That is why it is so important to do social distancing to reduce the spread again. Our goal is to spread this down. It's a marathon, not a sprint. So we want to reduce the spread of the virus over time. I do have an audio visual. Dr. Ryan, my able assistant there, thank you for that. So we have launched this afternoon a COVID screening drive-through clinic. And this is, let me orient you to the photograph. This is an aerial photograph. The hospital is up there, UMC's up there. The softball and tennis courts are down here at Texas Tech. So this is the south part of our campus. The main entrance here. And we're asking people to drive around. Their signs bring you in here. You'll be screened. Now this is important. I want everybody to understand this. So just as Dr. Ryan said, we're not testing everybody. You can't just roll up and say, I want to test. You have to meet criteria for testing. So we have screeners here who are going to ask those questions. If you roll up and you're drinking your coffee and you don't have a fever and you don't have a cough, you're going to be asked to head on out. We're not going to test you, okay? So know that before you come out, that we are screening. That's just necessary. That's a required piece of doing testing. If, however, you do meet the criteria, then you shuttle over to this parking lot where there's waiting, and there are up to 9 chutes that we can do testing in. You'll be directed to those as they become available. It doesn't take very long to do this screening. Now, first phase of the screening is flu test. As I said, we already launched this afternoon, and I was told before I came over that mostly we're seeing flu. No surprise. That's still prevalent, and it looks very similar to COVID. So we test that first. We might test strep if it's indicated. If that's all clear, then we'll do the COVID testing. Now, I want to update everyone that we do have access to a state-waived COVID test. And so CPL is a lab in Austin that provides this test. They're approved, and we're using them to help offload some of the volume. We expect there'll be some volume out of this testing. And so that's a vendor that's now available. And just as Dr. Ryan alluded, we're going to see more and more tests available. Here's one that's just come available this week. I would be remiss without bragging on our team. UMC physicians set this up, and they did it in 6 days. We went from nothing to a clinic that is wired and connected into our EMR and got a new test in, all those things. That is incredible work. And so Glenn Frick is our leader there, and he did a super job getting that going. A little about some of the things that we are doing. As Dr. Ryan said, we are limiting visitors. We're down to 1. Both of us are limiting to 1 visitor, and that is just a good health precaution, right? I didn't hear you say, but we are also we are limiting 17 and under kids. And that's just a practical note. So a young kid's got to have somebody with them. If they come up there, that's 2 people. We want 1, right? So we're limiting to 1 visitor. We also have moved forward with canceling elective procedures at this time. We will reassess that in 2 weeks. The rationale behind that is that those patients use resources that we may need for a surge of illness. And so we're thinking along those lines. Dr. Ryan and I have shared information that we're prepared if we see increasing cases. There are things that we will do to respond to those volumes of patients. So it's very important that the citizens know about that. So let's say you're at home and you have fever, cough, respiratory symptoms, but you're not feeling that bad. What do? One of the things you can do is use telemedicine. So there is an app that you can get, My Team Care Now. Download it from the App Store, both platforms. You can log in and have a doctor visit wherever you are. And if you're not feeling that bad, I would recommend doing that. That's a good thing. And that doctor then can tell you whether you should do something else. So that's an opportunity. We do have a few other specific announcements. One, those who use the UMC Urgent Care Clinic in our Medical Office Plaza 2, we're closing that clinic. We don't want ill patients coming in and exposing other clinic patients. We have a maternity clinic, for example, in that area. So we're closing that clinic effectively to reduce the spread of infection. We are screening, and I believe Covenant is as well, all visitors who come into the facility for temperature. So if you walk into our door right now, we have staff who are checking temperatures, and that's just to identify people who might have a fever. Those folks will be referred for screening and testing elsewhere. And so just know that if you come up to the hospital. We've already talked about the limitation of visitors. I would say one thing, and I think Dr. Mitchell said it yesterday at the press conference. Things are coming at us fast. We're moving like at warp speed here. And so things will change, so be aware. What we said today is effective today, but that may change going forward. I would say we've been in conversations. If we see more widespread illness in the community, we may really restrict visitors. That may come. Not now, but it may come. So just be ready for changes. And that's really all the prepared statement that I have. I guess we may have some questions.
Yeah, let's Let's do that. Let's, first of all, just on the health department, if I might add, we've added 15 extra bodies to answer the phone at the health department. They're Lubbock, and they're trained Lubbock Fire and Rescue members. So you've got paramedics and the EMTs. They're trained to do that. They're supported by a number of Ms. Wells' team. I was out there, had lunch with them today. We'd had north of 220 calls when I left there about 12:30. That's more than we had all day yesterday. Now, we want people to call their primary care provider first, or their clinic first. That's the first call, okay? If you don't have one, call the health department. The number is 775-2933. It's option 1. Option 1 is for patients. Option 2 is for providers, I believe. But those resources are there. A lot of the questions they were asking today were along the lines, I went to Rosa's on Tuesday, do I have a problem? I mean, it's just sort of that the fear in the community. The answer to that is no, that they were cleaned and well cleaned after Sunday night. But if a phone call would keep someone from panicking, then let's make the phone call. These two gentlemen are very professional. You get the case of, they talked about the way they're approaching this. We need to cut down on the panic. This whole idea of the social media discussion and solving all of our problems around this virus is, if nothing else, frustrating at the lowest level. And these guys deal with it. We deal with rumor control. We deal with patients that want to tweet out their videos of them in our medical facilities. And I guess they have the right to do that, but it sure impacts what we're trying to do. And you guys have been fabulous as the media helping us with that, and I want to thank you for that. But let's stay the course and talk about what the truth is. Okay? I'm going to take questions here 1 sec. Make sure I got. Oh, don't show up to the health department wanting a test. We can't do that. And if your physician's office sends you there, let us know. We need to talk to your physician. We've had one, supposedly that's the case. I don't know. One thing I want to applaud these guys for, I didn't mention it, the idea of canceling elective surgeries for Covenant UMC is a big deal. I've sat in the boardroom and understand how healthcare finance works. And you make money a few places and you lose money a lot of places. And elective surgery is one of those places that helps keep the doors open. So that I applaud. I think we've had some others of our joint ventures with physicians that have done the same thing. I hope that all our local surgery centers will join that for 2 weeks, and let's put our focus on knocking down this virus. Okay, let's take some questions. We'll use this microphone. Sarah, we'll start with you.
I'm Sarah Self-Walbrick with the Lubbock Avalanche Journal. Can we go over some specifics of this drive-through testing? What the most recent criteria to get that test? What do people need to bring? And what is the cost, if any?
The testing criteria is the same as we've been talking about all along. So fever, cough, respiratory symptoms. We do want to know about travel. It's not an absolute requirement now because we're starting to have cases all over. There are cases in the United States, et cetera. But at the very minimum, respiratory symptoms. So if Mayor Pope was saying that if you went to the Rosas and you're worried you have it and you got no symptoms, don't come for testing because you don't really meet the criteria for testing. That's very important. We do the other screenings that I mentioned, the flu and potentially strep, just to look for other pathogens that might be causing the illness. Flu is still very prevalent in our community. We hear from our doctors that they're seeing lots of flu. We're seeing lots of flu just initially at the screening clinic, and so that's very common. In terms of information, we will gather information from the patient. Mainly, we need demographic data. We certainly need a phone number. So you will not get a result today if you get swabbed today, right? That's got to be sent to Austin. The turnaround time is between 24 and 72 hours, depending on what's going on with their lab. Volume can have an impact on the turnaround time on lab. So we need to be able to contact you afterwards. We're going to ask you to go home and isolate yourself if you've been tested, because you kind of meet the criteria, right? So you need to go home and isolate. So those are the big items. If you have insurance, you should probably bring your insurance card. We're told from this lab vendor that they will reach out to the patient to do the billing. We're not going to do the charge of the lab. That's from the vendor. And so that's a piece of this. There's some discussion about what all is going to be covered from a federal level too, which is uncertain right now. But I think if you have information about insurance, bring it with you. We'll ask some demographic information, do some screening questions, and then work through the process that I described.
Okay, so no upfront cost. We don't need to be bringing $40 or anything like that.
No.
Okay, thank you.
Dr. Reagan, I have a couple of questions for you. How do you know when they drive through? You said they'd be tested for flu, strep, possibly COVID. I mean, at what point, like, do you say, oh, it's probably just a sore throat, we're only going to test you for strep throat, and they will not continue on to COVID? How do you decide?
Yes. The nice thing about the testing for flu and strep is that we have rapid tests for those. So we can swab you and know within 30 minutes, or I don't know the actual turnaround time on those tests, but pretty quick, that you'll know if it's flu or not. If it's flu, then we feel pretty good. That's the cause of your symptoms, and we can recommend treatment, and you can go. And usually the treatment for flu is supportive treatment anyway. So those are rapid tests up front, and then if those are negative, and we'll know that right at the time, then you may advance to the COVID testing if those have been negative. And that's kind of been the standard that we've been using even in hospital testing everywhere, is those kind of layers of testing.
Great. All right. Also, you said one visit per patient. Does that mean the whole time that they're there, you're recording this one person is the only person who's allowed to visit them, or one person at a time?
So there's a complicated answer to that, slightly, and I'll explain that. If you happen to be in isolation, so you're a patient in our hospital, and you might be in isolation for TB, or worry about TB, it might be the flu, it might be a possible COVID case. We have to use personal protective equipment in those rooms, right? So we have to put masks on, the whole get-up, gowns, gloves, all the things that you've heard. And those supplies are becoming limited in the country. And so we want one per day if the patient is in isolation. So preserving our equipment. If you are not one of those people, then it's one at a time.
All right. Also, which urgent care clinic is closing?
So there is an urgent care clinic on the first floor of the Medical Office Plaza 2 on our main campus. That clinic is closing just to reduce the flow of, that's what they do, is see sick people coming in urgently, and so we're closing that clinic.
And I have a question for the mayor. I'm sorry, and then I'll give this up to somebody. Mayor,
Yes, ma'am.
With the governor announcing today new mandates for no more than 10 people, doesn't that change your updated disaster declaration from yesterday?
It does, and we'll talk about that at 6 tonight. We have a couple questions still about it. We think there's one gap in there that we're still trying to get clarification. But yes, it does, and we applaud. I applaud the governor's move. I think it's solving. At least we're going to all be at the same place.
I have another question. Christy Martinez Garcia, Latino Lubbock Magazine. I know that you have 3 confirmed cases as of now, but how many people do you actually have in quarantine, and how many folks do you have awaiting results from the test?
So that's changing all the time. While I've been standing here, that may have changed. So those figures are hard to have in concrete. You're correct about the positives. As of this morning, correct me if I'm wrong, I believe we had 6 people who had tests pending. Now, that doesn't include anybody who has had a test referred today. There was already, as we came over, one from the drive-through testing area that had been sent. And I don't know for y'all.
We have had multiple people actually rule out. The only hard and fast number is the number of positive, and those are the 3 that Dr. Reagan referred to. We have about 3 patients in the building right now that we are waiting on some test results. We think the probability is exceedingly low, so we're not too worried about those patients, but we honestly expect this volume to step up dramatically in the next few days and weeks.
And
So You may have noticed that the state has talked about total numbers of tests. We're not talking about that because they will not allow us to release those total tests. We went back yesterday or day before when we saw those numbers come out. We still have been told that that's not our that's not for us to release. These guys can talk about what they choose to talk about, but total tests that we've run since we began testing is an unknown number. It's not like I know it and I'm not telling you. I don't know it, I don't want to know it, but we know at the state level what it is, and that continues to rise.
And then because you serve so many folks or the rural communities, what is the plan of action for those folks? Because I know that especially University Medical Center, you serve a lot of those folks in the county and surrounding counties.
Sure. Dr. Ryan mentioned it a little bit, and I'll let him answer in a second. What I would say is, I think we're of the same mind. Patients who need to come, we want to bring to our facilities to care for them. One of the challenges is not everyone, certainly not everyone with COVID-19 needs to come. Many of them need to be not in any hospital but at home. And so we're working with our partners to try and clarify that. And one of the important elements of that, too, as you move patients, we have to be very open and communicative that we have a patient that we're suspected. It's very important, and we're working with our partners to do that. And Dr. Ryan has a perspective about the larger region, and I'm sure you'd like to.
I'd love to. That's a great question. It really is. One of the things that has traditionally gone on in healthcare across the South Plains is when a patient has a worrisome diagnosis made, it is unbelievably common and a reflex for our rural hospital partners to just automatically want to put that patient in an ambulance and send them straight to Lubbock. The issue is 80% of the patients that have COVID-19 have it diagnosed, tested positive, do not require hospitalization. It is an absolute waste of resources, time, material, personal protective equipment for the rural hospitals to think that just because somebody has a positive test, they need to be sent to Lubbock. We don't have the capacity to just put people in hospital beds or in isolation units because of a positive test. Those patients belong at home. If they have severe respiratory distress or severe exercise intolerance, I mean, they can't take 5 steps without stopping to gasp for breath. Those are the patients that need to be in our isolation units.
And I do have to ask one more question, and that question is because there's been mixed issues about the testing, and first we heard it was free, then we heard just right now that possibly if you have to have insurance. Is that the wrong message to be sending for those? I mean, we already have a community that tends to be resistant to health issues. Is that the right question or response?
We're not charging for the test. The vendor who's doing the test has a charge for the test. And remind me of the cost. Does anybody remember? $90, I believe, is what we said. So that gives you an idea.
But with individuals not working.
If you have insurance, you should tell us so that can be billed. We're being told that much of this testing may be covered. The vendor who we're working with, CPL, it's an Austin-based firm, they have told us that they believe that all these tests will be covered by the federal government. So I would encourage people to get tested. We'll worry about that on the backside. We do that all the time. Patients come and they're not able to pay, and we manage that. So the real important thing is, if you believe you have the illness, you should come and be tested. We can work out the other, and it will not be up front. Absolutely, somebody asked that question, but that is not true. You can come and be tested.
We'll do one more question. Anybody else? Can you just walk through why it's so important if someone does think that they have the virus to get tested?
Well, so if you know you have it, then you can avoid others and not spread it. You all saw, Dr. Cook, I think, had the 2 curves, the curve that overwhelms the health system and the curve that doesn't. And we're shooting for the curve that doesn't. Absolutely. Both of us, in lockstep, don't want that big curve. We want the flatter curve. And so if you know you've had it, you should isolate. We've had some issues around that, but we really do want to limit the spread. And so that's a reason for testing, to know that.
Let me add one more wrinkle to that, and I think this is incredibly important. some of the patients that have tested positive shrug and say, oh, well, I've got it now. I got nothing to worry about. I can go wherever I want to go. That's the wrong answer. That is a socially irresponsible thing to be doing, and it puts the entire community at risk. We need our citizens to step up and understand that even if they have the COVID-19 positive test, that's not the end of the discussion. The real issue is how many more people are they going to give it to. And our citizens need to love each other enough to not do that to each other.
I'll say amen to that.
I will too. I will too. Thank you. We don't want Abner to get mad, so we'll give you one question. I mean, yeah. We'll do that at 6. Okay, that's our briefing at 6. We'll see you again at 6. We don't think these guys have to be part of that, and we'll do what we've been doing at 6 o'clock tonight. We'll also talk about the public emergency declaration and answer some questions around that at 6. And you know, we did it. We moved it back to 6 because our news the last 2 nights about testing has come in around 5:30. We hope we don't have to add any more to that tonight, but we did that based upon our experience. I want to, one final thing. If you don't have insurance and you're concerned about the testing, you know, reach out to the health department. It's free. What we do through Texas Tech is free. We'll get you to a health provider. If you pass that screen and you need to be tested, that test is free, okay? So we like these guys said, if you feel like you need to be tested, let's get tested. Thank you again for being here. Thanks for stepping up for our community. We're very thankful for that. And we will see you guys later.